And as of this morning, there are no positive cases in Woodbury County, but let's send it over to the health department right now.
Woodbury County. First and foremost, I want to let you know that we have no confirmed cases of COVID-19 in Woodbury County at this point in time. And we will continue to update you if that status should change. One of the things that I want to make you aware of and kind of share, because sometimes the public is trying to figure out for themselves, what do some of these concepts mean related to what we're recommending for good public health practice. So for example, in today's planning, some of the things that we took into consideration as a public health agency is we put it out here at the Security Institute because we knew there would be a wide space available so that the participants here to be able, from the media outlet, would have an opportunity at least to do some limited level of social distancing. We did not want to crowd you together because that's a very important sort of concept that we need to model and make sure our community understands. Also related to that is, there have been a series of governors' press conferences that have come about, and there's been some different announcements, and so one
we're showing our true colors. Would you want to sing a little?
Appreciate the media for doing is your willingness and ability to be able to share information for our public, our residents in that, so they can keep in tune with what's occurring locally. I think it's somewhat to monitor at the national level, but I think it's the local perspective that most people need to be assured and information related to. Some of the things that we have had to do is force a change of all of ours in our behaviors. These changes come about when we talk about the concept of social distancing, that minimum of 6 feet. When we also talk about some of the recommendations in that where they're closing down some of the facilities, our schools, all those sorts of things are put into, in this case, those are good public health strategies that we take a look at limiting the spread. Because part of what we look at is whether we have confirmed cases or not, there are things that we need to encourage our residents to do to protect themselves. And I think these are some of the things that we see going on in the community. They're creating some stress and we're being challenged to follow through it. We do have to thank all of those organizations, the schools, the businesses, the media themselves, food establishments, and all those that have taken these recommendations, and they have worked hard to voluntarily comply with those. We have to acknowledge, because this is an interruption to them and a change also, as we are also asking residents to do. These are all strategies that when we talk about the concept of flattening the curve. And what we mean by flattening the curve is that any disease, when it's introduced into either a population, a community, has the potential, with especially a disease like this, and influenza, measles, and those, that when it comes into a community, it's going to have a very quick escalation. The problem that we have with this is if any of these cases require medical support, such as hospitalization and that, we know that that's kind of a static line about our capacity. So really what we're looking at doing by flattening the curve is we want to limit the spread and reduce the number of cases that, first off, cases overall, more importantly, that require that strong healthcare intervention so that we can keep the number of cases below what our healthcare community can absorb. And I think that's the real priority that we take a look at as far as flattening the curve. And that also reduces, kind of the spread of it. One of the things that occurs is that we do get that first confirmed case. We will be making the announcement. We will also then educate you about what action plan for us as a public health agency that puts into progress. Some of the things with contact, follow-up, investigation, those types of things. We'll educate you about what that is so that you can educate the public so they're more assured. And more importantly is, just like the medical community having a limitation of resources, I do not have the staff to absorb all that overabundance of calls coming in from the worried well. So we need to really focus it for those individuals that we need to be able to reach out to. And I think those are the things that we just want to ask the population's cooperation with. In good public, there's a few other things for residents to consider and to be thinking about. On Monday, I was with the Sioux City Council. One of the things they pleaded with me, is there any way to stop this hoarding or oversupplying, stocking yourselves on different supplies? Some of the things when you talk about how does this impact my home and my behavior as a resident, there's things to think about. I visited with some staff with the aspect of they do grocery shopping, and their grocery shopping occurs that they get up in the morning, they may decide what's the option they're going to have for food that night, and they go to the grocery store Monday. They're back at the grocery store Wednesday. They're back at the grocery store Friday. They go on the weekend because that's kind of their planning. What we are asking residents to do is to really take in consideration are there things they can do on a household by household basis to reduce sort of those trips into some of those facilities. And I think it's taking a look at what I would say is in basic preparedness, as we know from this situation is, if anyone is asked to be isolated, it's only for a 2-week period. 2 weeks seems like a long time, but I think that would be a good enough target for individuals to consider when they are prepping up to supplies to plan that. Now, if you're looking at food supplies and that sorts of stuff and what you're doing, please also support our local food establishments, but they're doing what they can to sustain their staff and also economic viability with this. So if you do get the carryout, go ahead and take care of that. One of the other things that has been brought to our mind that's kind of a level of certain concern is we all know that Sunday night into Monday morning gave the announcement that all of our county schools and most of the schools across the state were not going to be holding classes for either until further notice or 4 weeks. One of the things we have to kind of ask the residents, and please, if you get the opportunity to visit with some young people, help them understand about what this means. You know, we don't want to be, we don't have enforcement of them voluntarily gathering, but we have some of the situations where, and what I hate to say is because we're very much into health and wellness and physical activity, but we're seeing groups of them with the weather turning nicer, they're congregating at some of our local parks and that in groups of 30, 40, or 50. That exceeds our 10 sort of recommendation to kind of minimum your group size. Maybe heading to the mall in mass sort of quantities may not be the recommended practice. They just need to pay attention, and I think our residents need to make decisions for themselves. And I think that's kind of that sort of I call it personal responsibility, but if we don't educate you to begin to think about some of the places you go, the group size that is there, we can't expect you to understand what is it you can personally do on that area. Businesses and the community college, or students at community college, all colleges are being forced to make many decisions. One of the things that has become very apparent is the volume of travel that occurs amongst our area residents. And I think with this travel comes a great number of concerns related to how do we handle those individuals that are returning from travel. And I'm not talking all foreign travel because that's been the terminology that's been used. I'm talking about any travel, foreign or domestic. Some of those that we have the situation, we work closely with the medical community. I was alerted yesterday that they're now getting people going to their primary care physician. They have been required by their employer to go in and get a return to work note, but it's specifically requesting that that provider also give them a return to work note that states they do not have the COVID-19 virus. That is not a possibility from the medical community because it would be a symptomatic sort of assessment as far as when we take a look at testing. And if they're not symptomatic, they're not going to be tested. And so I think it's recommending that those employers, the schools, they go to the CDC, the COVID-19, and there is a whole set of information related to travel, businesses, employers that they can use as a guide and a resource with they and their human resource individuals. Or if they don't have that, the small business owner can go there to take a look. And that gives you sort of an outline of the most current recommendations and standards related to looking at an employee returning from travel and returning to work is what you should request or require them, in this case, to do. And so some of those require the 2 weeks, some of them don't, but I think that's the best source of information. And that's the one that is also updated. And if we ended up getting calls, that's where we go to. So we would ask people to review that first before they call us for some other guidance and information. And we understand sometimes there's clarification. So I think we need to do that. And I think one of the things is today we called the tech press conference related to because this constant conversation related to testing going on within the community. I think within this testing a week ago when we did our press conference, we were not presuming some of the limitations and kind of the guidelines they were going to continue to impose. We had the perception with most items that come about with diseases. When you look back at the H1N1, we had to tier out individuals that qualified for the vaccine in 2009. There was high-risk populations. Those are the only ones we could give it to. In a public health perspective, as we're expanding capacity, it's the same situation we're incurring. However, on this tide, it's related to getting the testing done. So I think part of what we're looking is last week we were anticipating, and as I said, it's an ever-evolving situation. Some of that status has changed, but one of the things that we wanted to do was to provide you the opportunity to share the information about the status of testing and answer maybe some of the commonly asked questions. So this week, what I'm happy is to introduce Tyler Brock, the Deputy Director, who also serves as our Lab Director at Siouxland District Health Department, and he's going to go over some of the talking points and also share with you the information about the status of the COVID-19 testing. So I'll turn it over to Tyler.
Okay, so testing has been a big topic. So testing for COVID-19 is one of the major issues for the public, both nationally, at the state level, and locally. While testing capacity is increasing at both the State Hygienic Laboratory, and when I talk about the State Hygienic Laboratory, sometimes I abbreviate SHL. So if you hear SHL, I mean the State Hygienic Laboratory in Iowa. So while testing capacity is increasing at both the State Hygienic Laboratory in Iowa and private laboratories, testing is not unlimited. The demand for testing is very great around the world, and it's important that testing supplies be used for the people that need it the most. The need for testing will be determined by clinicians at primary care facilities and hospitals. Many offices are now using their reference laboratories or their private laboratories in addition to SHL. Public health approval is no longer necessary for testing at SHL, but their testing is primarily reserved for our most ill individuals and our most at-risk people. The private labs may have less required criteria in order to do testing, but their capacity isn't unlimited either. In fact, for most people with mild symptoms, testing may not even be indicated. We're hearing the frustration about testing availability both from the public as well as from the medical providers who are struggling with requests from their patients and the uncertainties that are associated with testing. We understand the demand for testing. Nobody wants more quality and accurate and available testing than Siouxland District Health Department does. But we all have to remember that this is literally a situation where everyone in the world wants a particular service at the exact same time. And testing supplies as well as laboratory personnel are not unlimited. So we're working with providers on a daily basis to make sure that testing is done when necessary. And we encourage our providers to reach out to their private laboratories so that they really understand what these private labs' capabilities are and what their processes are as well. We also know that communication is always the first thing that breaks down in emergencies. And so we're asking, and especially in a situation like this where things are changing so quickly. But it's important that staff throughout our medical offices also know how to communicate these testing procedures to the public, that it's not just the doctors that know, it's not just the nurse who answers the phone that knows, but it's people throughout the office that understand the procedures so that we can clearly present the information to the patients that are calling. Even with all this being said, public recommendations for people in Iowa isolating themselves when they are sick are the same whether or not they are tested. The current recommendations for people in Iowa that are ill with fever and a cough or shortness of breath should be to stay home and isolate from others in the home until you have had no fever for at least 72 hours. And when we say 72 hours, we're basically talking about 3 full days, and that includes without taking, some of our fever-reducing medications. So stay home and isolate from others in the home until you have had no fever for at least 72 hours and other symptoms have improved. So your cough and your shortness of breath has improved and at least 7 days have passed since your symptoms first began. So again, I want to repeat, these recommendations are for people regardless of whether they've been tested or not. We can't completely depend on a test to start some of the isolation procedures when people are truly symptomatic of this illness. So again, it's like Kevin already indicated, it's going to take everyone's cooperation with these efforts, both testing and then some of the other things that Kevin talked about. It's going to take everyone's cooperation to protect our most vulnerable people, our most vulnerable family and friends, as well as keeping our medical system from being overwhelmed. So with that, that's kind of our comments, unless there was anything else, and we would be able to take some questions.
Kevin, as far as the action plan you were talking about, and if we do get that first confirmed case, then I would imagine are both main hospitals in Sioux City prepared with capacity or isolation wards prepared, kind of like we've had in Omaha, or what have the hospitals been doing to prepare for what could be inevitable?
I guess hospitals are consistently prepared for any sort of infectious contraction or disease containment. So they do have certain isolation sorts of things, and that's when I talked about reducing the curve. I mean, those also are limited, like all the other assets and resources. This is a common thing that they discuss. They have infection control professionals that are on staff that assess this, and they will be, they're qualified and able to handle this. However, like I said, it's dependent upon the number of cases. They're going to have to make decisions for what they have for their capacity related to other treatments. That's the importance of reducing the spread. So this is a common thing, whether it happens to be COVID-19. They have protocols in place for influenza, pneumonia, all those types. They are enacting those, but they're just, kind of a little bit extra cautious and considerate and in their planning and due diligence related to this, because what they're looking at doing is, one is, we're looking at individuals that are, if you are symptomatic, what things we have to remember is, if you are diagnosed with this, does not automatically mean you will be hospitalized. There are those that self-isolate at home that are recovering if they don't have other. It's if you deteriorate that hospitalization potentially would occur. But our reality is we don't want those that are symptomatic showing up the emergency room, because that takes resources and time for their staff to assure the appropriate level of protection for them and also to be able to guide them in the best place. So I would say, I'm comfortable and confident that the hospitals do have the capacity to respond. But like I said, as the numbers increase, then they're going to have to make decisions about how they best serve the cases that are presented to them, not only for COVID-19, but their regular work.
Part of my reason for asking that, too, is we're kind of coming at the end of what would be the normal flu season, although I know it can go on for a while. And sometimes in the winter months, we get a lot of patients in both hospitals because of flu or other respiratory ailments. So I was just curious if we've been talking about COVID-19 for the last few weeks. Are the hospitals okay then as far as general patient capacity, or have we had a lot of flu cases or other ailments too that you're aware of?
We're still well into the flu season, so there's plenty of influenza still going around, and we know that the hospitals have been pretty full the whole season. So it's a challenge on a day-to-day basis with the hospitals and their patient loads. I mean, they obviously would know that better than us, and for the most part, we're taking that just anecdotally as we've met with them on various issues. We're hearing that the hospitals are pretty full even before COVID-19 started.
Are we still seeing people going to the hospitals with those symptoms? I mean, even though we've told people to call ahead of time?
The question was asked, are we still seeing people reporting to the ERs, even though they've been directed not to? We haven't heard about an undue number of those, but I think what we're looking at doing, it'd be wonderful if we could reduce it to 0. And I think we've really directed, and that's why our messaging has been really looking at your primary care provider so they can assess, they can triage, and that sort of stuff, and then they can work with that individual to make the recommendation of what level of care they need to seek. And we are also working with the first responder community related to just sort of their response and reaction and what plans they have put into place. So I think there's just a lot of planning behind the scenes that we're looking at, A, protecting the population that respond to this need, and B, being responsive and be able to get treatment and the right level of that to any resident that may be affected.
Have you had to do any tests for COVID-19 yet here in Woodbury County?
In COVID, for COVID, those are symptomatic, yes, there have been tests that are done. And they have all come back negative.
Do you have a number on that you've done so far?
No, the testing numbers, because testing is being done at multiple laboratories, we don't know exactly how many people have been done. It's not a lot, but again, a lot is kind of an undefined. So yes, we will not have numbers of people tested because of the number of different laboratories that are doing the testing.
And Tyler, you said before supplies are not unlimited. Do you guys have sort of what's the maximum number of people that would be able to be tested in Woodbury County under the current supplies?
That's hard to know. I don't know exactly how many supplies each individual doctor's office or the hospitals have. There would be enough. I guess I would just be speculating on that. I don't know exactly how many there are, and everybody is constantly trying to get more supplies in, so they're trickling in. But again, it's one of those things that if you have just a sudden onslaught, the ability for folks to get tested it does become limited, and so it's really the focus is really getting people tested that need it the most. Okay. Again, I said it already, folks with mild symptoms generally are probably going to be told, no, you don't need to be tested. okay? And in most cases, they don't. So we're really trying to focus the testing on the people that need it the most. And again, the doctor's offices and the hospitals that are taking these calls from the patients, they're under a lot of strain as well, because they've obviously seen a major increase in the number of calls from their patients. Some of them that definitely need to be tested, but a lot of them that definitely do not. But they're kind of being forced to sort through them all. And so it's been a struggle. It has been a little confusing, and nobody's denying that there's been some frustration with it out there. But there is the ability to be tested here in Woodbury County, here in Sioux City, here in Siouxland for those people that need it the most. There's absolutely ability to do that.
Something you mentioned was seeing large groups of kids starting to congregate. I mean, is there anything that we can do to stop that? Is there a plan to maybe close parks?
At this point in time, that would be a decision. I mean, the question was, is there anything we can do with some of the gatherings and the congregating of kids and that sort of stuff, and anyone, as far as what it would be is to restrict that. The city has been very sort of straightforward about closing down, looking at limiting and that type of stuff too. I think it's something that if we see, I mean, it's also weather dependent. But I think the key of what it would be is it's the education, so it's because much as our entire community, that population doesn't quite understand. And if we look back to the teenage years, that was a point that we were usually very social and interested in gathering wherever we could. And I think the concept has been is when you take a look at it, I mean, you look at the snow days, when there are some barriers to being able to travel, they're still finding places to congregate. So I think it's with your assistance is what it would be to continue that messaging through whatever channels you would to alert them that there's a certain amount of risk with them gathering in groups of larger than 10. And if they could self-monitor and do that, that's the cooperation. We've seen cooperation so far. We'd like that also exhibited within that. And I think it's also some of the adults and parents understanding, having the conversation with their children. Other questions? If not, we truly want to thank you as our outlet for sharing information.
And again, that was Kevin Green and Tyler Brock with the Siouxland District Health Department. And a quick recap of what was said. If you did miss it, there are no confirmed cases in Woodbury County of COVID-19, but Kevin Green stressed that there be social distancing in our community, meaning staying 6 feet away from others. Now, the first confirmed case will be announced, and the plans as well when that does happen, but residents are encouraged to halt hoarding and overstocking at local grocery stores, and they also say that parents should educate the youth on what's happening around us. Now, Tyler Brock also mentioned that testing is not unlimited. It's only for those who need it most. And testing is available here in Woodbury County, and it will be determined by clinicians for most at-risk folks. But those who are ill with fever or cough, separate for 3 full days with anyone around you without medication, and then symptoms must be improved and 7 days must have passed before you can be around others. Now, we will bring you more from this press conference on our midday show at 11:30, as well as our KCAU-9 News at 5 and 6. Also, a quick reminder that KCAU-9 is hosting a coronavirus live discussion with local health experts. So tune in tonight at 6:30, either on air or online at SiouxlandProud.com, and we'll tell you what you can do to protect yourself, your family, and the community, all while clearing up misinformation. Again, that's tonight at 6:30 right here on Channel 9 or our website, SiouxlandProud.com.